everybody, and welcome to our special training on intimacy during menopause. We are live here in the Menopause Sisterhood, and if you are joining me live, just drop a comment, say hello, let me know that you can hear me, let me know where you are coming in from. Whilst I'm waiting for everyone to arrive, I'm just going to do a technical check to make sure that you can all hear me. So just bear with me for 1 second. Yes, there we go. Okay, so we are live in the Menopause Sisterhood. If you're watching this on replay, you may be watching me on my YouTube channel. And I just want to say welcome to all of you. We have a very, very interesting and I hope meaningful training tonight. And if you are watching, let me just give you a couple of heads up notices or some disclaimers before we start. We are going to be talking about vaginal dryness. We are going to be talking about low libido. We are going to be talking about sex. We are going to be talking about lots of things that you may not want certain people in your environment or vicinity to hear. So if you are watching this live, if you're watching this on the replay, let me just tell you that this is a private conversation. This is a conversation where I'm going to be talking about lots of topics that some people may feel uncomfortable about. I don't feel uncomfortable talking about these things, and I am very passionate about opening up the lid on all these topics. I don't think that anything to do with women's health or menopause should be shameful, but we are going to be talking about sensitive topics. We are going to be talking about things you may not want children to be hearing about. You may not want, colleagues or co-workers to be hearing about. So let me just tell you that if you want to put some headphones in or you want to listen to this, in a room away from other people, now is the time to do it. And if you're watching on replay, then, just make sure that this is not on full volume in the car while you're driving carpool. But I'm hoping that and I really believe that this training is going to give you really valuable information about what to expect during your midlife, perimenopause, menopause years, as it relates to your intimate relationships, your changing body, and a lot of things that we really don't talk about, that women are embarrassed to discuss with their doctors, even embarrassed to discuss with their gynecologists or OBGYNs. And very often we are suffering in silence, because if you are in an intimate relationship, and we're going to talk about all the different ways it can show up, you may feel shame, embarrassment, you may feel guilty that things have changed in your intimate relationship where before they were a certain way. And a lot of other things that sort of come up. It's not just the physical symptoms that we are going to be talking about in this session, but it's also the emotional impact that we're going to be talking about. So if you are here, if you are joining me, please give me a thumbs up in the comments. Let me know that you're here. Let me know that you are watching. Yes, it looks like it is all going well. Okay, so let us start. Many women experience changes to certain in their intimate relationships, in their 1 second. That is just a child calling. Let me just make sure that she calls her father, who is on call. Hold on, sorry for the technical. Okay, sorry about that. Okay, let's get back to it. The main problem that many women experience during this time, and when I say this time, what are we talking about? We are talking about perimenopause, menopause, into postmenopause. As we know, anyone who's watching, menopause is defined by 12 period-free months. After, you mark a calendar, you're tracking 12 period-free months, and you are biologically, officially in menopause. During this time, there is major hormonal fluctuation, but much of the hormonal fluctuation starts way before those 12 months, and that is in the years leading up to those 12 months, which we call perimenopause. And in perimenopause is when most women experience many of their symptoms. How long is perimenopause? For some women, it's 2 years. For some women, it could be 10 years. It's very, very personal, very specific. But during that time is when we are experiencing all these hormonal fluctuations, all these symptoms, as we call them, and very often some of those symptoms can persist into postmenopause. Postmenopause being those years after you end your period. And the reason why symptoms can persist is if we don't deal with them in perimenopause and don't deal with them in menopause, some symptoms just will naturally and normally sort of improve. But many symptoms will persist because if you don't deal with them, they are still going to be there. They are still going to be persisting, and you haven't done anything to help or to treat them. So they're still going to be there. So, what type of things are we talking about when we are talking about changing intimacy? And there are a lot of different things that are going on. I'm just getting a notice about connection, so I hope you can all hear me. I hope that you are following. I'm looking forward to your comments and to your thumbs up. If there is a problem with a connection, please let me know. So what type of things are we talking about? What type of symptoms when it comes to intimacy and relationships may you possibly be experiencing, or what changes? So the things that we are looking at include, and there is a long list, on the most basic levels: vaginal dryness, vaginal atrophy, itching, just feeling very uncomfortable in the vaginal area. Next, we may be looking at painful sex, uncomfortable sex, maybe potential spotting or bleeding after sex. It could even be, when we go back to that vaginal atrophy, even when you sit down for long hours, if you're wearing tights or if you're wearing trousers or jeans, it may be really, really painful and uncomfortable. Okay, so then we're looking at painful sex, uncomfortable sex, maybe even some type of bleeding or spotting after sex. We are also looking at burning, dryness, as I said, irritation. In terms of the sexual symptoms, we said painful sex, uncomfortable sex, low libido, low sexual desire, in some type of impairment when it comes to being able to orgasm. So you do want sex, there is libido, there is desire, but actually reaching an orgasm may be a different experience to maybe what you are used to. Arousal in general may look different. What worked for you before when you were in your younger years in terms of arousal may have changed now. And urinary symptoms, urinary tract infections, an increase of urinary tract infections, um, uh, leaking, pelvic floor support may not be what it used to be. There may be a lot of changes in the pelvic floor area. As we've said, leaking, prolapse definitely, or some type of prolapse, even if it's not a full prolapse. But any type of leakage, any type of incontinence, any type of urinary tract infections. So these classifications of symptoms, I know it sounds really, really fun, used to be very compartmentalized. They now come under this new term that is being used in medical literature called genoutinary syndrome of menopause, GSM. Genoutinary syndrome of menopause, GSM. And it is divided out into those genital symptoms of all the issues, as we talked about, around the vaginal dryness and vaginal atrophy, around those sexual symptoms of low libido, painful sex or uncomfortable sex, arousal, and those types of things. And then the urinary symptoms, such as increased infection, urinary tract infections, leakage, prolapse, anything to do with pelvic floor muscles that are not supporting you, and the resulting impacts of that. So obviously these are topics that women often don't want to talk about. Many of my clients come to me for other reasons, for other symptom treatment. And then when I go through the list of potential symptoms that they may have, and we talk about libido and sex and those types of things, all of a sudden they yeah, I have no libido. I have plenty of my clients who say to me, it's not that there is low libido, there is no libido. And we're going to be talking about that, what that means, why it happens, what we can do about it. But just so that you know that these symptoms can show up in lots of different ways. As we said, there is a long list of ways that things can change in the vaginal area with sexual arousal, with urinary function. So there are lots of things. It is common. As I say, with all symptoms, these are common, these happen. It is not to be expected because no symptoms should be expected. We should expect to enjoy every stage of our lives. And especially when it comes to these specific symptoms, the intimacy, urinary, vaginal symptoms, they impact us in many, many ways. So let's talk about why they are happening, and then we'll talk about what it means and how they impact us. So, why are these symptoms happening? Um, One, before we go to the why, I just want to say two things. The first thing is there are some women, and there are absolutely are a group of women um, where actually their libido increases, their sexual fantasy or sexual desire increases. They may be having other issues potentially. There may still be vaginal dryness. There may be urinary tract infections. There potentially could be other things connected in this group of symptoms. But actually, libido may have increased, and sexual desire and the enjoyment of sex may actually have increased. And I want to mention that also as a perimenopause, menopausal symptom, even though it sounds like, oh my God, like, I wish that was my problem. For some women, um, it may not be a problem, but it's something that we need to address. It may be a problem if you're not in an intimate relationship. It may be a problem if you are recently, don't have a partner. You may recently be divorced, or you may, there are lots of reasons why in the reality of your life, having extra high libido, increased sexual desire and increased sexual fantasies is a good thing, but maybe your specific situation, it becomes a little bit more challenging. But yes, there are plenty of women who experience exactly the other side of the spectrum. In terms of statistics, um, there is one study that I read, and I will add all the notes and the references in the comments below. That said that in Western populations, so specifically Western populations, between 45% to 63% of postmenopausal women reported that they'd experienced vulvovaginal symptoms. So vulvovaginal is vaginal dryness, vaginal atrophy, lack of arousal, those types of things. With most common being vaginal dryness, vaginal irritation or vaginal tenderness. So just feeling very like that area is just super sensitive, super dry, super, I guess sensitive is the word. It just, you don't really want to touch it or go near it or have any type of stimulation in that area. Um, and in another research that I read, 70% of postmenopausal women, we are talking here of the research specifically looking at postmenopausal women, but we know that this really applies also to the perimenopausal and menopausal women, that without treatment, symptoms tend to progress. And this comes to the why. We know certain symptoms will go as we navigate our menopause journey and head into postmenopause. But there are some symptoms that persist. And we then have to look at the why are these symptoms happening in the first place. And specifically, these symptoms, these GSM, the genitourinary symptoms, um, occur um, for a number of reasons. Primarily, the fluctuating and eventual reduction of estrogen in our body. We know estrogen is um, women's health protective, especially and particularly in the vaginal area. Estrogen is very, very supportive. And when we lose estrogen, it is particularly reflected. Often, one of the first places we feel it is in the vaginal area. We know that fluctuating estrogen levels and eventual decrease in estrogen levels in postmenopause to our new low levels are result in many, many symptoms. These specific symptoms really have been found to be directly related to reduction in estrogen. And the reduction in estrogen in that area does a couple of things. Firstly, it really weakens the pelvic floor muscles. Secondly, it really creates a thinning of the vaginal lining, the vaginal tissue, the vaginal wall, which results in a number of things. Firstly, it is thinner, it is more sensitive, it's not as protective as it used to be, which is why maybe you may find spotting after sex, or this very irritability, the dryness, the itchy, is because of the lack of this estrogen, which is very nourishing. And the increased urinary tract infections is often happening because as the vaginal wall becomes thinner, the dividing line between the vagina and the bladder, urethra, becomes thinner. So bacteria can pass through much easier between both areas. So there is potential increase for urinary tract infection. That's one of the reasons. So this changing um, estrogen levels are one of the reasons for some of the symptoms. The second reason is the changing levels of testosterone. Now, I know we always think that testosterone is the male hormone, and if you have been following me at all in the Menopause Sisterhood, you will know that testosterone is a super, super important female hormone. It is the precursor to estrogen. Women have, in a woman, we have less testosterone than men. So in relationship to men, we have less testosterone, but in relationship to estrogen, which is the feminine hormone, we actually have more testosterone. So in a woman's body, testosterone is actually more dominant than estrogen. And as those testosterone levels naturally decline, we are going to find that we are less, we have lower libido, less sexual desire. It also impacts us in other ways: low testosterone, low energy, low motivation, potential brain function impairment. But testosterone is like the gas in your car. It is the thing that is getting everything going. And when you don't have the gas, everything is slower, it is sluggish, it's not working as well, including everything related to sexual desire, libido, arousal, and all those types of things. Energy, exhaustion, tiredness, sort of all those things are also related. So there is the estrogen role in the symptoms, and there is the testosterone role in the symptoms. The third element that is really, really important is level of stress you are under. And we all know that when we are stressed out, and when we feel under more stress, when we are exhausted, when our mind is preoccupied with other things, um, our engagement in intimacy with our partner is usually much reduced. So we've talked about the role of pelvic floor muscles and that the impact of estrogen on pelvic floor muscles is sort of is playing a role, but the pelvic floor muscles themselves and supporting pelvic floor muscles itself is also going to play a role. We talked about the role of testosterone, and I really don't want to underestimate the role that stress is playing here. Stress plays a critical role in our overall health and well-being. It plays a critical role in our symptomology, how our symptoms show up, and what type of extent we have symptoms. And it plays a really important role um, with these symptoms also, how it impacts our ability or lack of ability to engage in intimacy. There is another factor that I want to bring up, and that is we've been talking a lot about the very physical side of these symptoms, but there is a really deep emotional side. And that is connected to as we go through our menopause journey, as we go through from perimenopause to menopause into postmenopause, our bodies are changing. Now, many women are going to be experiencing weight gain. Some women actually experience weight loss, but whatever happens, we are very, very aware that our body shape is changing. Regardless of the weight, just our body feels different. Um, and we may not feel as comfortable in our body. And especially if you are experiencing weight gain, you may not feel as comfortable in your body anymore. If sex is uncomfortable or painful and you don't feel comfortable in your body, it may add layers on to wanting to be intimate with your partner. If you have a long-term partner, there are emotional issues going on there. If you are um, newly single and you have a new partner, or you are just, available and enjoying this stage of life and, having a lot of fun, all of this plays into um, your ability or desire to want to be intimate with someone if you don't feel comfortable in your own body. If you feel that your body is changing, you have new aches and pains, you are gaining weight, you don't recognize yourself in the mirror, to then create that intimacy um, may be challenging, and that may add to and exacerbate whatever symptoms you're going through. So I really want to add the emotional piece as to why this may be happening. It is not, you may be having some symptoms, but they may be exacerbated by the emotional side, by the changing identity, changing body, not really recognizing yourself, or other symptoms that are having knock-on effects onto how you are connecting with your own self. And that will then have potential knock-on effects to how you are relating, or how you are able to show up in these intimate relationships. So really important that we not only just look at the hormonal piece of the puzzle, which is critical, but there really are layers going on here as to why things may be more challenging for you. Um, on the plus side, as we age through our menopause journey, and especially into postmenopause, the not having to deal with periods, the not having to deal with spotting, and also remember, as you're in perimenopause, your periods may be doing all strange and weird and wonderful things, less heavy, more fluctuations, close together, further apart. The unpredictability of your period cycle may make having sex a bit less, more erratic or less predictable. But as we enter postmenopause, there are some pluses that are happening now. Actually, we may feel more confident. There is more freedom. There is more knowing what you want. This is absolutely the postmenopausal woman really stepping into the postmenopausal identity of more confidence, not being scared to say what you feel, not being scared to say what you want, what works for you, and what may bring you more pleasure. And also the issue of not having to deal with periods, and maybe you can have sex now, maybe you don't want sex now, all those types of things related to your cycling, that sort of all goes out the window. So actually, as women enter more into their postmenopause years, the potential for enjoyment in this area is actually potentially greater if we sort out the issues that may be challenging you. Okay, I'm going to take a break for a second. If you are watching and you have any questions, please let me know. If you feel uncomfortable asking your questions live in the chat, I totally understand. You can send me a DM through the Menopause Sisterhood, and you can just ask me any of your questions. I'm happy to answer any questions that you have. Some people have sent me some questions beforehand, so I will answer them at the end. But please let me know. Give me a thumbs up. Let me know if you're watching. Let me know if you have questions. This is a safe zone. This is happening in the Menopause Sisterhood. I will not say your name if you ask questions, but I want you to feel comfortable to ask them here. And if, again, if you want to do it anonymously, you can send me a DM also. Okay, so we have talked about what symptoms potentially you could be experiencing. We've talked about why this is happening. We've talked about the potential um, plus side of this that may occur as we head more into postmenopause. And now, as promised, we're going to look at the three ways, excuse my finger that got a nice cut from a blender, three ways that we can actually manage, navigate, treat, potential solutions for dealing with the challenges that we've been talking about. So the first thing is, one of the things that has happened, as we mentioned, with the reduction of estrogen is that there is less fluidity, less lubrication, less estrogen support in the vaginal area, in the vulvovaginal area. And one of the things that we want to do is we really want to increase blood flow, increase that suppleness, get those, those cells and the tissues in that area really stimulated, really full of blood, really working well. And that is one of the things that will really help to get that area more aroused, more stimulated, more functioning. We can do that in two ways. Ironically, one of the ways to do that is with increased sexual activity. So the more sex you have, in theory, the more you're bringing good blood flow to that area, the more you're stimulating that area, and the more it's going to be beneficial to that area. Of course, if sex is uncomfortable and painful, if you have vaginal dryness and atrophy, it may be difficult to do that, and we'll talk about, potential solutions. The second way to do that is really with pelvic floor muscle work. And as a yoga for women's health teacher, one of the foundations of the things that I do through my yoga work is really looking at the pelvic floor muscles and how do we stimulate them? How do we work with them properly? How do we improve muscle tone? How do we really engage with that area to improve pelvic floor muscles and allow those pelvic floor muscles to really support our vaginal area? With the work that I do, we really connect with that area in a physical way, and also to increase sensitivity and stimulation, and to really learn how to use those muscles so that they are really, really supporting us. Pelvic floor muscles is not just about giving birth. They're not just about Kegels. They are super important for women throughout our whole lifespan. And working with pelvic floor muscles is really, really critical to helping us support that whole area. So that's the first thing. The second way that we can improve our functioning and really help to support us is most easily and most simply with vaginal estrogen cream, localized vaginal estrogen cream, suppositories, depending on what country you're living in and what is available. But vaginal estrogen cream is a localized topical estrogen cream. It has very, very low risk because it is not really entering into the main bloodstream. It is really localized and topical and staying in that vaginal area. And many women have had a lot of success with vaginal estrogen cream. I know that in some countries it is available over the counter. In other countries, you may need to have a prescription from your doctor for it. But this is something that doctors are very happy and very willing to prescribe. There is less stress about the whole hormonal side of things with vaginal estrogen cream, but many, many women have found that their symptoms really get treated very nicely with vaginal estrogen ointments. We have had the first solution is pelvic floor muscle work and sort of increase sexual activity. The second one is the vaginal localized estrogen cream. The third way that you can really help treat your symptoms is non-hormonal solutions, such as supporting that area with things like coconut oil. Um, I mentioned the pelvic floor work, okay? But coconut oil is a great way to relieve a lot of the vaginal atrophy, the dryness during sex, the uncomfortable sex, the painful sex. A lot of that is can be really helped with the coconut oil. If you want to really deal with the urinary tract infections, with the potential spotting, with the thinning of the vaginal wall, you really need to go down the estrogen route because that really is going to help to nourish that area. If you are only dealing with painful sex, uncomfortable sex, irritability, um, dryness, that is really quite specifically around intimacy, around intercourse, potentially maybe during the day sometimes also, coconut oil is a great, easy solution. Women have a tub of it next to your bed, and whenever you have, you know, sex or any type of intimate relations with a partner, take that coconut oil and enjoy. So that's definitely something that is very, that I really recommend. I think that's three, but I'm going to give you a bonus. And this really goes to the heart of what's going on here. We do have the physical symptoms. We do have those symptoms that are very real, and that are very, very challenging for many women. But the thing that we talked about intimacy, not necessarily sex, sexual desire, libido, closeness, connection with your partner, your changing body, your changing sort of connection or engagement with your own body, not feeling like yourself, not really feeling that you recognize yourself anymore. Again, whether you are or not gaining weight. Um, we need to think about nurturing our intimate relationships. Again, whether you've been in a long-term relationship, whether you are newly single and starting out in a new, fresh relationship, whether you are, enjoying multiple relationships, whatever it is, wherever you are on the spectrum, no judgment, no assumptions, no shame, no guilt. This is about you and your experience. One of the things that we really need to be looking about is how do we nurture and strengthen our intimate relationships wherever they may fall, in a different way. Because it may have been that your intimate relationships were maybe a lot about sexual connection. And if that sexual connection doesn't exist in the same way, how are you nurturing these intimate relationships? And for many women, their menopausal symptoms, their menopause experience, the um, urinary, sexual, genitoury symptoms that we've talked about that are showing up in lots of different ways just has an overall impact of, I just don't really want to be intimate anymore. Like, it's just not as much fun as it used to be. And if you are in a relationship with someone, that really can start to have a powerful impact on your connection, on your deep, on a deeper level. It's not just about the sex, or it ends up being not just about the sex. It ends up becoming about the connection you have with this person. And if you are with someone where they are very into sex, or sex has been a part of your um, relationship, and all of a sudden now it's not part of your relationship, what is happening? And for some people, that can be very challenging. For some women, they have amazing supportive partners and they negotiate it in all different ways. For some women, their partners get very frustrated, then there's a lot of guilt on their part. For some women, as we talked about, if you are in the opposite end of the spectrum where you have high libido and you are really interested more in, a lot more sexual activity, you may have a partner that can't keep up with you in terms of you maybe were having, whatever your frequency of sexual activity was, but now you want to increase it. They may be tired, they may have stress at work, they may be going through things, and they may not be wanting to keep up with you, and you may feel frustrated. It may make you feel bad that they don't want to connect with you in that way. So there are lots and lots of different things here at play. So one of the things that we really need to be thinking about is how do we strengthen our intimate relationships by leaving sex out the picture. It doesn't mean that sex needs to be ignored, doesn't mean that sexual interaction needs to be totally ignored, but we need to be thinking about how do we do intimacy in a different way, or in a variation of ways. So this really is the thing that we need to be thinking about. Examples of ways to create intimacy that are independent. I'm not saying ignore sex, but are independent of sexual activity. Um, Date night, just going out with each other, enjoying spending time with each other, remembering why you enjoy and want to be with each other. Stimulating each other in other ways that may not necessarily result or start or end with specific intercourse. Lots of ways to excite and engage and stimulate each other. The coconut oil comes into play there also. Um, you know, Other things that very often women in midlife, perimenopause, menopause, we don't really think about, we're not really, don't have time for, is, going out to see a movie, going out together to do something totally different. And we often are so exhausted. We're often so busy dealing with teenagers or elderly parents or whatever it is. You may need to schedule this in. You actually may need to say, right, in 2 weeks' time, we're putting a scheduled, date night or activity night or fun night or whatever it is in the diary. You may decide you want to go away to a hotel for a night. You may want to, change locations and, do something different. It doesn't really matter what you do. And yes, this spontaneity that existed when we were younger, you may need to schedule it. It may need to be, in the calendar. You may need to sit together and say, okay, what is the night that we can both free up? Um, but then it's in the calendar. Then you know that you have that time. And it may need to be something that you do on a regular basis. Once a month, you have date night. Once a month, you're going to, do something interesting or do something a bit different. If you are in, and again, it depends where you fall on the spectrum of relationships. If you are in a long-term intimate relationship, this is critical. This is really, really critical, because those long-term relationships are the ones that really take a beating when all this stuff happens. If you are in a new relationship, if you are newly single and you're in a new relationship, it may be easier because the excitement, the enjoyment may itself be stimulating. If it's not enough, then you may want to, suggest some interesting, exciting things to do with a new partner. Otherwise, again, going back to that coconut oil, that vaginal estrogen cream, looking at the other triggers that you may have, as we said, stress, pelvic floor muscles, um, and so we really want to think about the personalization of where are you, what is your specific personal situation, and what are your needs, and how can we adapt these solutions to your specific needs. But really, the looking to create intimacy in a different way is one of the strategies that I really work with some of my clients. And again, creating intimacy that is independent around sex, if sex is a really challenging experience for you at the moment. Okay. Questions, put them in the chat. You are definitely free to DM me, to email me if any of you, if this is resonating for any of you. If you want to email me at the yoga room, one word, the yoga room 120, all one word, at gmail.com. Feel free. Before we end, I did have some questions sent in to me, and I just want to answer them. So someone messaged me about VLA. VLA is vaginal laser ablation. And it has been something that is becoming more talked about, more popular as a way of treating the vaginal area, um, vaginal atrophy. It's a way of treating vaginal atrophy, dryness, all those types of things. So, what is my recommendation and what do I think about it? Personally, and this is my personal thought, I really do not advocate vaginal laser ablation for two reasons. Firstly, it is not really getting to the root of the problem. It is not restoring the estrogen that has been lost in the vaginal area. So if you really, really are suffering with, you know, debilitating or extreme vaginal atrophy that is showing up in burning, itchiness, dryness, uncomfortable when you're sitting, and all those types of things, the ablation just sort of removes some of the tissue, but it's not really getting to the root cause, which is we need to support the tissue in that area. We need to support the vaginal cells in, you know, with estrogen cream. So that's the first thing. And secondly, it really is only temporary because as long as you're not supporting your estrogen, and again, actually, I want to just put this disclaimer here. You can also support your estrogen in other ways. Our overall estrogen levels are changing. It's not just the estrogen in the vagina that is changing. Our overall body estrogen is changing. So if we're supporting our overall estrogen levels in numerous ways that I work with my clients to naturally support your estrogen levels, that may also help. But because vaginal estrogen cream is so easy and so safe, many women choose to use it. But if you are supporting your estrogen levels, whether through local topical estrogen cream or naturally through integrative practices, which is really what I do with my clients, um, that should support the vagina and its sort of you know, the way that it changes through perimenopause. The vaginal laser ablation is temporary because the lack of estrogen will make it atrophy again. The lack of estrogen in the vaginal area, the lack of support in the vaginal area, um, eventually the ablation will wear off and the problem will just reoccur. So it's only really temporary, and the potential damage of having laser in that area, you know, it's not such a, it may work for some women, but it's not such a safe or let's say potential health implications of laser in that area. Obviously it's safe, which is why it's being recommended by some people, but I really, really don't advocate it as a first starting point. Um, the second question that was asked is we talked about stress, but people asked about does nutrition and sleep and exercise play a role here? So, you know, or what role does lifestyle play here, leaving stress out? So, anyone who has been following me for a while, anyone who, you know, knows how I work with women, my integrative functional medicine based approach is looking at all these things. How do we support ourselves in perimenopause, menopause, and postmenopause? How do we support our hormonal chaos? How do we treat our symptoms without just going for the hormone replacement? That's not to say that hormone replacement doesn't have a role, but I'm much more interested in setting you up with strategies that are going to support your health and wellness now and in the long term. And so, yes, what you eat, when you eat, how you eat, your exercise levels, your sleep, all of this plays a role in your overall hormonal health and balance and wellness, and absolutely can play a role in your um, in how you're feeling. Um, it's very possible that you are doing exercise that is actually potentially weakening your pelvic floor muscles, and then that's going to have other knock-on effects. Um, So yes, the role of your overall lifestyle, and we also know, you know, if you're drinking a lot of alcohol every evening as a way of relaxing, calming down, that also is going to play a role in your um, intimate relationships, in the sexual dysfunction. I don't like that word dysfunction, but in, possibly low libido and low sexual desire and all those types of things. Okay, the next question that was asked, I have two more questions that was asked. So the next question is about testosterone. Now, we talked about testosterone, and someone has asked me about the role of testosterone in treating these symptoms. So we talked about estrogen, we talked about the vaginal estrogen creams, we talked about, generally supporting our estrogen levels. But we did talk about earlier the role of testosterone in sexual desire, libido, enjoyment of sex, arousal, stimulation, all those types of things. So, what are the testosterone potential strategies in all of this? So, thank you for asking that question because it's really, really important. Unfortunately, testosterone for female use is not FDA approved. Big shocker, FDA testosterone for use for men, for males, is FDA approved, but for women it is not FDA approved. In Australia, I think there is some type of treatment, testosterone treatment available. But in general, around the world, what most people do is if they want testosterone support, they go to a doctor that understands testosterone, and usually a woman is prescribed a tenth or a ninth of a male dosage, and it usually comes in a transdermal gel or cream or something like that. I strongly support testosterone use. It is not localized testosterone like local vaginal estrogen cream. It is overall use. You rub it in on your thigh, on your inner thigh, on your stomach area. If you are able to access testosterone and you have really no or low libido, low energy and motivation, low focus, low sexual desire, just really, as we said, like there feels that there's no gas in the tank and you can get testosterone, I absolutely strongly advise you to go and search it out. If you can't actively get testosterone hormonal support, there are other things you can do to naturally boost and support your testosterone. One of the easiest ways is with strength training to build up the muscle mass. And we're not talking about being bodybuilders. We are not talking about that, but we are just talking about doing some strength training, resistance training, building up those natural testosterone levels in your body. And that definitely is super helpful. And I think that is it. Okay, so a quick review. What have we talked about? What have we discussed? We have talked about what these symptoms are, sort of what this new phrase, new terminology that we are using, I need to read it from a page I don't know off by heart, the genitourinary, yes, genitourinary symptom of menopause, GSM. It's a very hard word for me, which includes the genital symptoms, the vaginal atrophy, vaginal dryness, and all related things. The sexual symptoms, which include the potentially painful or uncomfortable sex, and everything that is related to that. And the low libido and low sexual desire, low ability for stimulation, the urinary symptoms, increased urinary tract infections. And we also talked about that there are women who can have high libido, and I want to recognize those women and let you know that that is also a common experience. We talked about the why. Why does this happen? We talked about the changing levels of estrogen and testosterone, the thinning of the vaginal wall, the role that stress plays, and potentially the role of other lifestyle factors that may play. We talked about that actually as you navigate into postmenopause, you may be experiencing actually more freedom, the lack of periods, more confidence to say what you want. That is actually, one of the things that may change as we get into postmenopause. And we talked about the potential solutions. I think I gave you more than 3, even though I promised you 3, but I think there was a bonus one there. And we also talked about not just the physical symptoms that are going on here, but the emotional, body changing, connecting with your own body, your personal experience with your body that may play a role in how you are showing up for your intimate relationships, and the role that different intimate relationships, depending on where you are along that spectrum, may play also. Okay, so that is the end for this training. Again, please let me know if you have any questions. Let me know if this has been helpful or useful or informative. This particular training will be up in the Menopause Sisterhood for a while, so you can access it on replay. If you're watching on replay, give me a hashtag replay, and I look forward to hearing from you very soon. I would love your feedback. Let me know how this has helped you and supported you, and I look forward to seeing you at the next training. Have a great day.